Welcome back. September is National Atrial Fibrillation AFib Awareness Month. To put it in perspective, an estimated 12.1 million people in the U.S. will have AFib by 2030. This afternoon we have Dr. Raj Kattar, cardiologist and president of the ProMedica Heart Institute, here to talk about the signs, the symptoms, and risk factors for AFib. Welcome. All right, now let's get exactly about what is AFib if you have it.
So atrial fibrillation is an irregular heart rhythm, very common. They think almost 5 to 10% of people over 70 years old will have this condition. And actually, we have a natural pacemaker in our heart that actually tells your top chambers to contract, the atrium and the ventricles. Can I show you here on the model here?
I love you brought props.
We brought props. We brought props. So here's the heart, and blood comes from your veins into the right side of the heart, to the right atrium, to the right ventricle, needs to get oxygenated, right? Goes to the lungs to get oxygen, back to the left atrium and the left ventricle, and pumped out your aorta to the rest of the body. So that's the pumping system we're all aware of. And we're talking today about the electrical system. In the top right atrium here, there is what's called the sinus node, which basically tells your top chambers to contract, and then the bottom. And then when you're running, and the body needs more oxygen, it'll drive it to a faster heart rate, but a regular heart rate. But even if it's faster, for instance, if you're jogging, your heart pulse will go up to 140, which is normal. But at rest, having a pulse of 140 is not. So what happens in atrial fibrillation is a random area in the atrium, electrical impulse starts to fire, many random areas start to fire, and the heart chamber fibrillates. Instead of contracting, the top chamber fibrillates, and then blood can sit around in the crevices, form a clot, and put some patients at increased risk of stroke. And that's the biggest risk with AFib.
Do you marvel sometimes at the human body and how complicated it really is and how it is just naturally set to function this way?
It's amazing. I've been cardiologist here for 25 years, and every day I'm still amazed at how this is all programmed and everything is taken care of. And it's amazing more things don't go wrong. So
what can you do if you suspect you may be having it? What are some of the symptoms, and describe it?
So the most common symptom is a fluttering in the heart. You can sometimes feel it pounding if it's going super fast. Sometimes it'll just feel irregular. I've had some people say they feel it like a quivering. Those can be other type of rhythm problems too. But when it's fast and irregular, that's when you probably should think about AFib.
Now, does everyone get this occasionally anyway? It's just when it happens on a longer term basis that you need to do something about it, or if you feel an occasional flutter, not to worry about it?
So fluttering is not abnormal. We can have skipped beats. We can be anxious, and our own heart can beat fast. If you're getting yelled at home or something like that.
Or you meet someone, your heart goes pity-pat.
Yeah, exactly. That could happen. Or if you're watching the Buckeyes game or the Wolverines game.
Or the Browns.
The Browns, you get tachycardic. That's a fast heart rate. I'm a Packer fan, so I'm always tachycardic. But anyway, I basically, this is different because if anything happens, what I always tell patients, anything that happens for a few minutes, and as long as you're not in great distress, having severe chest pain or shortness of breath, don't panic, right? But if it's something that's persistent and you don't feel well with it, then you need to get it taken care of right away. And if you're really feeling not well, you should go to an emergency room. And there's usually someone on call always to be able to take care of that. But the ER would evaluate you with an EKG, and they could tell readily if you're out of rhythm.
So you could be getting a stroke. How do they treat that to fix the electrical issues?
So when you bring up stroke, so I don't want people panic that every time you get AFib, you have a stroke.
Yeah.
It just increases the risk. So for instance, on an annual basis, depending on your other risk factors, it can be anywhere from 3 to 7 or 8% increased risk of a stroke if you're in AFib constantly or even intermittently, but not for a few minutes. You have to be out of rhythm, many people think, for well over 24 hours to 48 hours, even before you can form a clot. Now, sometimes, Dan, the first time that people present with the AFib is that they've had the stroke. And then you find out they've been in AFib.
Yeah.
And there are many patients who don't have any symptoms of AFib. I'm amazed. A lot of patients don't even know they're in AFib. So getting regular checkups, when people say, why do I need a regular checkup? It's important. But if you do have these symptoms, you'll know. For instance, it's not normal if you're sitting in front of your TV or laying in bed to suddenly have your heart racing.
Yeah.
Correct? But if your heart's going fast, if you have a fever or something of that sort, that may not be as unusual.
Then does it get treated with meds, or do you have to go in invasively and put a new something in?
Well, yeah, it's a very good question. So the first step is when you come in, let's say you're found to be in a fast AFib, or what's called rapid atrial fibrillation, then we would give you medicines to slow it down. And if you are at increased stroke risk, then a lot of times you're put on a blood thinner. And then it's decided whether you need to get the heart back to normal rhythm. And that can be done with medication. Sometimes in a controlled setting, they'll do something called a cardioversion, where they'll zap your heart back to normal. Don't worry, they put you to sleep before they would do that. And that's in a controlled setting. And then if people continue to have problems, there's procedures where you can actually electrically modify the heart with catheters called ablation, where you can permanently.
So a lot of
try to
tools
fix
in
AFib.
your toolbox.
There's a lot of tools in the toolbox.
Okay. Raj Kattar, doctor, thank you so much for being
Thanks.
here. Be right back. Chris?